Hi, I'm Erica Hill, registered nurse, and I'm here by invitation from Glenda Hargroves Phillips, the Compass, and Sisters of the Sand to present to you a brief talk on breast cancer awareness. Every 23 seconds in the U.S., someone is diagnosed with breast cancer. 1 in 8 women will be diagnosed, and 1 in 1,000 men. That's right, even men are diagnosed with breast cancer. Some of the things that we want to make sure that you are aware of is that in some cases breast cancer can be prevented. So it's very important that women and men are very much aware of their breast tissue. You want to inspect for any kind of lumps, any kind of dimpling of the nipple, any kind of nipple discharge, and any kind of pain. But I also want to note that some people have no symptoms at all. You want to be aware of your breast, your history, your family history, because some cancers are caused by gene mutations. So in our body, cells grow and divide and die every day. But when that growth is out of control and it comes away from the normal growth pattern, then a tumor can form. And the most classic tell symptoms of breast cancer is that lump or mass in the breast. You want to be aware of changes in breast tissue as far as color and shape as well. Sometimes the breast there can be what we call asymmetry, where one breast is larger than the other. You want to be aware of that. I also want to note that breast cancer is more prominent in the African American community, and we'll talk about some of those reasons here in the end of the video. What are some of the risk factors of breast cancer? Again, the family history, any kind of gene mutations, hormonal changes, sometimes age, growing older, ethnicity, where we discussed that it's more prominent in the African American community, Hispanic, Asians, and Pacific Islanders have an increased risk of breast cancer, and also starting your periods, your menstrual cycle at a later age, or menopause at an older age. Also, pregnancy, becoming pregnant at an older age or never being pregnant at all are some of the things that put you at risk. So it's very important that you know your family history. Women over the age of 45 who have a very close relative like a mother or a daughter or a sister who has breast cancer, you increase your risk of developing breast cancer. So know your family history. Be familiar with your own breast tissue. Have genetic testing performed if you are at risk. You should be having, if you're over the age of 40, mammograms should be performed at least yearly, and a clinical exam by your primary physician or a gynecologist. Clinical exam is called, again, every 3 years. And if you are at risk for breast cancer, your provider can tell you what tests you need to have performed to rule out breast cancer or to do the screening for breast cancer. Also note right now that the exact cause of breast cancer is not known. However, there's a lot of good research that's going on, and right now the mammogram is the best way of those images of the breast is the best way of determining if you have breast cancer or not, or if you have an increased risk, and then further testing can be ordered from there. And with the genetic testing, there will be blood work that will be taken. And anything that's abnormal, have that checked out. A lot of times we allow fear to mobilize us and keep us from going to the doctor and going to see about ourselves. But we want to stress the point that breast cancer the outcome can be successful if you seek treatment early. Do not let fear keep you from seeking treatment. There are a lot of good community resources out there. that in your clinics that offer free mammograms. There are mobile mammogram units that come around in different neighborhoods, also where you can have the mammogram performed for free of charge. And also check with your community clinic, your social workers, your case managers that can help to have you set up insurance so that you can get the care that you need. Yeah, we want to be on top of that because prevention is very important. Let's also talk about lifestyle. Some of the lifestyle changes that can be modified so that you can decrease your risk, like being smoke-free, like maintaining a healthy weight. Diet, exercise can also help. Diet that's high in fiber, less processed meat, less sodium intake can also help. And balancing that diet with fruit and vegetables. And something that's very important as well is limiting your alcohol consumption. And environmental factors like too much exposure to the sun, too much exposure to radiation can help to reduce your risk. So it's very important that we know our risk factors, all of us, and that we be familiar with our own breast tissue again. That we have those screenings performed yearly, every 3 years, and sometimes sooner if we have a high risk of family history. So today I'm encouraging you to be empowered, to be informed. You yourself, if you have breast cancer, to allow your friends and family members, your physicians, to provide you with the support that you need, or to be able to give the support that's needed. And utilize those community resources like Susan G. Komen, like the American Cancer Society. They provide free transportation back and forth from treatment. So get out there. You can find a lot of these resources online and see what those resources are so that you can get the care that you need. I'm going to include also in this presentation also in this talk, a presentation that I put together as well that you can look over later. And I hope you all have a good night. Thank you for allowing me to come out and present to you tonight.